Hello again, Nursing 111 students. This is the second half of the nursing process, and we will begin with planning. Just a quick review. Assessment, the system and continuous collection, organization, validation, documentation of data. That's where we collect everything. Diagnosis, we take the data, we interpret it, we go through ACLI to formulate a diagnostic statement. After we have our diagnostic statement, we come to the third part of the nursing process, planning. Planning is the third phase in the nursing process. It is also deliberate and systematic. It involves decision making and problem solving using your critical thinking. It uses the patient's assessment data and diagnostic statements for direction and formulating a patient goal and nursing interventions. Planning begins with the first contact and continues until the nurse and patient relationship ends. What planning is the process of establishing goals or outcome that you set that address the nursing diagnosis. Poor planning leads to poor results. There are 3 steps in the planning process: setting priorities, formulating desired outcomes or goals, and selecting the nursing interventions. And we will go through each of the 3 steps. Step 1 is setting priorities. Like we had talked about in the earlier lecture, each patient will have several nursing diagnoses, and you need to use your critical thinking to prioritize which nursing diagnosis is the most important to the health and welfare of the patient. A review is using Maslow's factors to consider when setting priorities. Like we said before, many times before, physiological needs are higher. We also have to take into account the patient's beliefs and values. The patient may not agree with what we think is a priority. And what is the patient's priority? Do we have the resources available to the nurse and the patient? What's the urgency of the health problem? And what is the medical treatment plan? So after we have selected our highest priority diagnosis, formulating desired outcomes is the next step. An outcome or goal is a broad statement that describes the desired change in a patient's condition, perceptions, or behavior. The outcomes and goals must be directly related to the nursing diagnosis. There can be several outcomes for each nursing diagnosis. It must be patient-centered. And an outcome is not a nursing activity. It is a goal that an RN wants the patient to achieve. It's important to remember. It's not the nursing activity, it's the end goal. Purpose for establishing outcome criteria: it provides direction for the care of the patient. It's critical for evaluating the patient's progress. And it's a guide to determine the resolution of the problem. And it should motivate both the patient and the nurse. The goals or outcomes should be patient-centered, observable, and must be SMART. It's in red for a reason. It must be SMART. SMART stands for specific, measurable, attainable, relevant, and time-based. So what do these mean? Specific. It's got to be concerned with a specific area or activity. You got to have really clear language when you define the goal as much as possible. Second thing, it's got to be measurable. You have to have a way to measure whether you met that outcome or not. Can the progress be tracked and measured? Third thing is attainable and achievable. The outcome is possible to achieve, is it? And make sure the goal is not out of reach. Realistic and relevant. Is it achievable with the available resources? And is it relevant to the patient's need? And lastly, it has to be timely. The outcome has to include a time limit, and the time limit set should be realistic. So let's go back to our patient, Mr. Klutz. Again, he's a 27-year-old male who fell down a day ago off a ladder trying to clean his gutters. He sustained a right femur fracture. He's in traction, and his only other medical diagnosis is type 2 diabetes mellitus. So we're going to create some outcomes for Mr. Klutz. First, we have to have that nursing diagnosis that we went through. And we had picked out a bunch of them: risk for constipation, risk for falls. Remember, everything always has to have a related to, acute pain related to fractured femur. So let's take one and develop a few outcomes related to the chosen nursing diagnosis. So pain seems to be at the highest level on Maslow's hierarchy list of the ones we have listed. So we're going to pick acute pain related to right leg injury. So our outcomes must be related to this nursing diagnosis. And remember, the outcomes must be specific, measurable, achievable, realistic or relevant, and time-based, SMART. So we're going to look at the outcomes that we can come up with. These are some possible goals and outcomes for Mr. Klutz. Number 1, patient will report a pain score of less than 5 out of 10 during the evening shift. Number 2, patient will notify nurses using call bell when he has pain greater than 4 during his hospital stay. Remember, these goals and outcomes have to relate back to the nursing diagnosis. So these all have to relate back to the pain portion of the nursing diagnosis, which they do. Next, we have to double check if these outcomes are SMART. Are they specific, measurable, attainable, relevant, and time-based? Patient will report a pain score of less than 5 out of 10 during the evening shift. Is that specific? Yes. Is it measurable? Yes, we have the 5 out of 10. Is it attainable? Yes, he's got oxycodone that can help his pain. Is it relevant? Most certainly relevant to his needs. And does it have a time base in there? Yes, during the evening shift. So outcome number 1 is a correct outcome. It's a SMART outcome. Let's look at outcome number 2. The patient will notify nurses using call bell when he has pain greater than 4 during his hospital stay. Specific? Yes, using the call bell. Measurable? Yes. We can tell if he is using the call bell when he is pain greater than 4. Attainable? Again, yes. As long as he's compliant and knows how to do this. Is it relevant? Of course. And is it time-based? Yes, we said during his hospital stay. So both of these outcomes are SMART outcomes. Step 3 is to select nursing interventions. The nursing interventions are actual treatments and actions that are performed to help the patient reach the goal that is set for them. So these are components of the nursing intervention. It's what the nurse will do, when it will be done, how it will be done. Think of these as actions that you actually perform. Those are what interventions are. So there are different types of interventions. Dependent. This is provider initiated. Activities carried out under the provider's order of supervision according to specific routines. An example of that would be giving medications at a certain time that the provider ordered. Independent. This is nurse initiated, and it's based on your knowledge and skills. It has to be within your scope of practice. It involves physical care, referrals, teaching. Then collaborative, again, nursing actions with other team members involved. The criteria for nursing intervention: first of all, it must be safe. It's got to be achievable and congruent. It's got to go along with the patient's values, belief, and culture. It's based on nursing knowledge and experience. It has to follow the established standards of care, and most importantly, it must be evidence-based. So evidence-based practice. It's a clinical decision based on best evidence, clinical experts, and of course the client's values. These are based on scientific principles. It's a problem-solving approach to clinical practice. And like I said, we'll have a lecture explaining evidence-based practice at some point in the semester. And again, you have to prioritize the nursing interventions just like we had to prioritize the nursing diagnosis and the nursing outcomes. So, of course, again, ABCs, physiological, high priority is life-threatening, intermediate is health-threatening, and low is normal development or minimal nursing support. So I think you understand that everything's about prioritizing. So again, selecting nursing interventions. What can a nursing intervention be? Observations, watching the patient, treatments, wound dressing, education, showing a patient how to use a needle before they get discharged from the hospital who's going to be on insulin. Prevention strategies. If they came in with pneumonia and they smoke, you're going to want to have an intervention to at least educate them about smoking. And that also falls under health promotion. So let's look at possible interventions for Mr. Klutz. From our nursing diagnosis of acute pain related to an injured femur, we came up with an outcome of patient will report a pain score of less than 5 during the evening shift. Remember, interventions are actions that lead to achieving the outcome or goal. So we want to try to do things that'll make the patient report a pain score of less than 5 during the evening shift. So some of the interventions, again, these are action items. Make sure his call bell is within reach. Give pain medication as directed by the order for pain greater than 4. Teach him non-pharmacological ways of relieving pain, guided imagery, deep breathing, a whole bunch of things like that. And educate the patient about not letting the pain get out of control. Once pain starts to get high, it's harder to treat. So that is basically the planning stage of our ADPI. So now that we have determined the interventions, we can move on to the next phase in the nursing process, implementation. So we're going into the 4th stage of the nursing process of ADPI, implementation. Again, we've done our assessment, we've gathered the data, we've figured out a diagnosis according to the data. Then we process the planning stage. So we establish goals or outcomes that was set to address the nursing diagnosis. Now we're going to go into the 4th stage, implementation. It's the 4th stage in the nursing process. It's action-oriented. It's outcome-directed. It's a continuous process. And most importantly, it's patient-centered care. Why patient-centered care? So they feel a sense of control. It's going to be individualized. Everybody's different. It's a sense of accomplishment for that patient. So it considers patient's values and beliefs, the patient's priorities, and available resources that you have. So implementation consists of doing and documenting the specific nursing action interventions that you were created in the previous stage to achieve the goal or outcome. The nurse performs or delegates the nursing interventions that were developed in the planning stage. So the steps of implementation. assess or reassess the patient, determine the need for assistance, whether you need assistance or they need assistance, implement nursing strategies that you will learn throughout your stay here, supervise delegated care. Delegated care is like if you told CNA and nurse assistant to go do something that's within their scope, but practice, you got to make sure that you supervise it and this person knows how to do that. And lastly but not least, communicate or document nursing actions. Assess or reassess the patient. You will hear us saying over and over again, assess, assess, assess. You cannot do anything until you assess the patient. It is the first step, and it's the first step of everything we do. Couple warnings: no advanced documenting. Document as close to the event as possible, and if it's not documented, it's not done. I've seen people go and get all their vitals down, they write them down on the sheet, and then they sit down on the computer and they go to document all at once. And in the meantime, something may have changed with that patient, and so it is not good to document. When you do it, document it. And again, if it's not documented, it's not done. So let's implement Mr. Klutz's intervention. You put his call bell within reach. You give him pain medication for pain greater than 4. You teach him the non-pharmaceutical ways. You educate him about how much harder it is to get pain under control when it gets bad. Those are all action items. Nursing care plan and the nursing process. Essentially, the nursing process develops a care plan for the patient by identifying patient's actual or potential health needs. It establishes a plan and intervention to meet those needs. Again, it's a systematic way of creating a care plan, again using evidence-based practices to approach the delivery of nursing services. So here's what we have for Mr. Klotz's care plan so far. We have his assessment data, which we've been through. We picked the nursing diagnosis from Ackley, acute pain related to fractured, should say leg injury or something like that. I put a diagnosis there accidentally. Outcome, one of the outcomes is patient reported pain score of less than 5 out of 10 during the evening shift. And then the nursing interventions, things that we just told them. So that's a care plan. That's what a care plan looks like. So we are finished with the implementation portion of ADPI. So we have developed a nursing diagnosis from our subjective and objective assessment data, planned our nursing interventions, and have implemented them. We now move to the final stage of the nursing process, evaluation. Evaluation. So now we've gone through 4 of the stages. Assessment, took the data, collected it, validated it, documented it, came up with a diagnosis using that data. Then we planned goals or outcome and interventions to achieve those goals or outcome related to the diagnosis. Then we implemented those interventions, which is the action phase again. It's doing and documenting. You can remember planning is a planning stage. You haven't done it yet. Implementation is the actual doing stage. And finally, we come down to evaluation. It's the 5th and final stage in the nursing process. It's a critical part of the nursing process. And evaluation is a planned, ongoing, deliberate activity. It determines whether the patient's conditions or well-being improves. You conduct evaluation measures to determine if your patients met the expected outcome, not whether the nursing interventions were completed. Big difference there. So evaluation measures. Examine the results of care by using evaluation members. Evaluation measures are assessment skills and techniques. Evaluation measures are the same as assessment measures, but they are done at the point of care when you make a decision about a patient's status and progress. The intent of the evaluation is to determine if the known problems have remained the same, improved, worsened, or changed. So the phases of evaluation. Phase 1. You evaluate the outcome attainment. You collected the data, compare data to the outcomes, relate nursing activity, and draw conclusions from that. So, did you meet it or not? Phase 2 is modify the care plan, where the outcomes met. Does the care plan need to be reevaluated? We'll go into these a little bit more. So evaluate the outcome attainment. You collect the data related to desired outcomes, ongoing, intermittent, or terminal, subjective or objective data. Draw conclusions about whether outcomes have been met using critical thinking. When do we evaluate? When the established time frame has occurred, when there's a change in patient's condition. So we compare the data with the outcomes met. The desired patient response occurred, or the actual response is the same as the desired outcome. Partially met. Some but not all desired behaviors were observed, or the desired outcome is achieved only part of the time. And not met. The desired patient response did not occur by the target time frame, or the actual outcome does not match the desired outcome. So you relate your nursing activities to your outcome. Review it to see if the nursing interventions or strategies help the patient reach the goal. Did the planned intervention work, or was there something else that helped the patient reach the goal that wasn't in your plan? In conclusion, has the actual problem been resolved? Are there still risk factors that need to be addressed? Step 2, care plan modification. So this is based on the evaluation. Does the care plan need to be changed? You must draw conclusions about the status of the patient using critical thinking. Review each step of the nursing process in the manner in which it is performed. If the outcome was not met or partially met, the care plan needs to be modified. Ways to modify a care plan: continued as is, but extend the time frame for outcome achievement. Change plan of care to make it more effective, such as choose a new nursing diagnosis based on new assessment data, develop new outcomes, or develop new nursing interventions. So of course we use our critical thinking when evaluating. Were the outcomes realistic? Was there enough time? Did the outcomes address all aspects of the problem? Did the patient agree? And was it part of the patient's priorities? The evaluation phase assesses if the nursing interventions have been effective or helpful in meeting the desired goals or outcome. Outcome met, yes, no, or partially met. If the goal or outcome is not met or partially met, we need to adjust the care plan to help the client meet their goals. A decision will then need to be made to terminate, continue, or revise the outcomes and/or intervention. Reporting and recording. Effectiveness is evidenced by a change in the patient's status, reported in shift report and in all documentation, and in interdisciplinary rounds. So in documentation, you need the date, the conclusion, what's supporting data, the signature, and the title. Your title. The evaluation statement has two parts. Conclusion: was the goal met, partially met, or not met? And the supporting data. Patient's response supports the conclusion. So you just pretty much restate the outcome. So here's Mr. Kless's care plan again. We went through everything. We did all the nursing interventions. And so let's look at an evaluation statement for Mr. Kless. Outcome: patient will report a pain score of less than 5 during 10 during the evening shift. If the outcome was met, the evaluation statement is: the outcome was met. Mr. Klutz reported a pain score of less than 5 out of 10 during the evening shift. So you're repeating the outcome. When you document the date, the time, the outcome. Patient reported a pain score of less than 5 to 10 during the evening shift. Sign your name and your credentials. So here's the same thing if the outcome was partially met. The evaluation statement is Mr. Klutz reported a pain score of less than 5 out of 10 at times during the evening shift. And your documentation would be the same thing, date, time, outcome. Patient reported a pain score of less than 5 to 10 at times during the evening shift. Now let's look at the last one. Evaluation statement, patient outcome was not met. The evaluation statement is Mr. Klutz did not report a pain score of less than 5 out of 10 during the evening shift. Again, you document outcome, patient did not report a pain score of less than 5 to 10 during the evening shift. So you would have to revise that outcome or the interventions. So conclusion, nursing process is using ADPI, step-by-step process, uses critical thinking in an order way for clinical decision making to guide good patient care. So through the nursing process, we're able to develop care plans which can be used by others. And according to the American Nurses Association, the common thread uniting different types of nurses who work in varied area is the nursing process, the essential core of practice for the registered nurse to deliver holistic, patient-focused care. So all nurses should be using the nursing process so there's consistency in patient care. And you have this in your notes. This is just a nice little ADPI overview. I will be giving a brief overview the next time we have actual lecture when you're in the classroom. Of course, please see me or email me if you have any questions on ADPI in the nursing process. You will use this throughout all four semesters here at MCC, and it'll get more intricate as we go along. Every clinical will be asking you to use ADPI and come up with assessment, diagnosis, planning, implementation, and evaluation. So that's all, folks. Hope to see you soon. Have a good day.